one more case of an infective pathology. Here is another case of a wrist swelling. The patient had been experiencing this wrist swelling since last 1 year, and it had been increasing in size, and there had been pain associated with it. And there was some history of a prior operation in the region of the wrist. However, the patient did not know what had happened, or had been the reports were not available at the time of this scan. So the patient here, today's patient, is a female who is aged 35 years. And here we see that there is extensive destruction of the bones which is seen involving the carpals. The proximal row of the carpal bone appears to be affected severely. The distal carpal row appears somewhat less likely affected, and more amongst that, maximally the trapezoid and the trapezium bones appear to be spared, and one more carpal, that is the pisiform, it has been spared. Rest all the carpals appear to be involved by the disease process. The disease also extends to involve the radiocarpal as well as ulnocarpal joints. There are erosions within the distal radius as well as distal ulna. And in the distal ulna, the erosion is extending up to the medullary cavity. On axial images, we see that there is significant distension of the distal radio-ulnar recess, joint recess. So the collection is seen surrounding the distal ulna. There is significant extension of this within the infection within the medullary cavity. Only a part of a cortex which is itself is thinned out is intact. So this type of infection, which is significantly involving the bones and has been there since a long time, it still can be a type of tuberculous pathology, a tuberculous type of infection. On usually in cases of infective pathology, we see this T1 bright rim sign. So this usually suggests an infection, and there are significant debris and septations within these collections. So now we'll trace the same collections in the axial plane. I'll just load axial PDF as images. So this collection, which I earlier mentioned, is in the distal radio-ulnar joint space, and the collection on the volar aspect, it is within the space of the Parona. So Parona space is the space which is a potential gap in between the flexor tendons, the flexor digitorum superficialis and the profundus tendons, and it is this space that gets usually involved in the infectious pathologies. Here we see the large collection which is seen distending this space and pushing the flexor tendons uh, around the periphery. So there is significant edema in the surrounding region as well. Now we trace the separate extensor as well as separate flexor tendons, and we see that there is no involvement of the synovial sheath in this tendon. So this is just a collection extending into the potential space or the gap which is left in between. Now we see that there are two things that we need to see while reporting in the wrist joints. So wrist is a small place, confined place. So even if there is any collection, if any fracture is there, any hematoma is there, it is going to cause compression or displacement of the adjacent structures. Here we see that on the volar aspect, two nerves would be seen which are crossing. One on the volar aspect, the main nerve that we see usually is the median nerve. So here is the median nerve, and as we trace it proximally in the forearm, we see that it is severely displaced by the collection, and it appears to be flattened in this region. So in the same way, in the region of the hook of Hammett, we'll be seeing the ulnar nerve. So just get the ulnar nerve here. So this region, the ulnar nerve should be there, and if we trace the ulnar nerve proximally, so this is the ulnar nerve, And if we trace the ulnar nerve proximally, we see that this nerve is also displaced by the collection and has been compressed because of it. So we need to see the vessels as well as the neural structures which pass through this region. I'll show one 3D sequence. This is a 3D T1 sequence I'll show, where we can appreciate the bony erosions well. So there is almost entire proximal carpal row has been collapsed and eroded. So this is another presentation of the same disease, the tuberculous pathology. In the wrist joint, it can present in this way as well. Yesterday we saw the presence of joint space involvement of the synovium, and this is involvement of the bone. This is the fulminant exuberant osteomyelitis. So in both the ways this pathology can present. Thank you.